how we can solve a job on atrophy cases with a graftless solution. Moreover, that is just not a solving case, but how we can improve the quality of life of the patient, because that's what patient comes for. This is again the same. The lady, see the periodontally compromised dentition, all teeth are flunging out. Her aesthetic appearance is totally compromised. Lips are incompetent. She's unable to smile. Oral health, bad breath, unable to face to husband. Okay, this type of problems patient do suffer. Female patients. Okay, but see then. All these things, small things matters if you are really working on changing their quality of life. Then we assess all totally periodontally compromised dentition. All the bone looks good, but anteriorly the bone was very thin, almost close to nil. You can see in the middle section, absolutely thin bone. So we decided not to go for grafting, because again we were a little concerned about our oral hygiene practices. Lower jaw bone was quite decent enough, but height is, see in the posterior mandible, the height is just 6 millimeters. You can see that. Okay, 5.7 millimeter height is there, or maybe 8 millimeter height is there. Yeah, 8 millimeter. So short implants, yes, but then you'll have to wait for long period of time. We finish this case in maybe around 3 days to 5 days. Okay, so this is before and after. After extraction, we place the implants. So we avoided placing implant in the anterior premaxilla, and we place the implants. The long implant which you see in the lower mandible is nothing but the basomandibular implants. So this is the post-surgical healing on day 1, day 2, and this is the post-treatment. We gave her transitional prosthesis. This is a transitional process given to the patient because we were expecting heavy amount of shrinkage. And this is the day 3 post-treatment radiograph, pre and post of the patient. Now, when the patient came after 1 year to change the process or get reline the processes, this is soft tissue healing. Can you see the amount of hygiene control with the patient is having with this? Okay, so that's fantastic because the implants are polished, the multi units are polished. Chances of peri-implantitis is close to minimum if patient can maintain it well. Okay, so this is the healing tissue of the patient after a year, and that's what is the patient smiling after this. So even her quality of life changed tremendously. Okay, are you getting it? Lovely. So this is the now 5 years follow-up of the patient. Patient is enjoying, she's very happy. That's why I'm showing you a long-term follow-up of the patients. This is again a patient. The main problem was she was not able to face her husband, so her husband decided to take her to me once, and her husband gave her a Diwali gift. This year you will smile beautifully. Okay, so that was a problem. See, our anterior, because the teeth is flunging around like the Spider-Man, so there is a huge defect there out there. You can see this area is a huge defect on both the sides, right and left. So there is technically only 2 sides where I can place implants in the premaxilla, that is in the central incisors area, and one is zygoma and one is the pterygoid. So only 6 sites I have found in our maxilla. That's it. Very atrophied case. We finished this case in 5 days, and this is a follow-up of the patient after 2 years, x-ray of the patient. This is before and after of the patient. Because of this flunging prosthesis, she lost a massive bone in canine region, but anyways, we didn't place any implant in canine. So this is the lightweight process of the patient. This is the patient before and after. You could see a drastic transformation in her smile. She's very happy. This is her husband. So he gifted her smile. So what she achieved is attention of her husband. That is also very important. That is also improving the quality of life. Am I right? I hope ladies can relate it very well, right? So social interaction, everything, all these parameters were evaluated. She is happily achieving, she's smiling well, everything is there.